Hospital capacity and trying to avoid straining that system has been one of the few constants throughout the pandemic. We know that Colorado's hospital bed capacity is lower than other states, and America's is lower compared to similar developing countries or to other developed countries. It's odd seeing that we are big spenders on health care in this country. Anusha Roy looks at why.
There are so many factors in judging health care. To level the playing field, let's look at the number of hospital beds per 1,000 people. Colorado ranks 45th on the list. Gut reaction? That's not great to hear during a pandemic. But this stat has been going down since 1999 as more people are getting outpatient care versus staying in the hospital, according to the Colorado Hospital Association. While Colorado's numbers are lower than other states, the U.S. is following the same pattern.
I teach this in my ethics class.
Dr. Ricardo Gonzalez Fisher at MSU Denver and a surgical oncologist broke the numbers down.
The United States spends much more on healthcare than any other nation in the world.
He said it's close to 17% of the gross domestic product, nearly double compared to other developed countries. But when it comes to hospital beds per 1,000 people,
the average for the OECD is 4.4. The United States is under 3. So we are below the average, even if we're spending double.
One of our sharp viewers who brought this up asked, how is that possible, especially during a pandemic when we spend so much?
It's a very long conversation.
Dr. Gonzalez Fisher said it involves the tangled web that is insurance companies, pharmaceutical companies, and our hospital systems.
But we cannot have 10 beds per 1,000 people just waiting for us to need them as an emergency.
Another factor is the healthcare system trying to strike a balance between meeting needs and what makes financial sense.
So we asked the Colorado Hospital Association, when it comes to the number of beds, was this a missed opportunity to be better prepared for COVID? Their answer was not necessarily when you look at how the state handled the pandemic so far. They said they did have to activate crisis standards of care for staffing, did not have to do the same for hospital care, Kyle, like we had seen in some other states.
I'm sure a lot of things go into this. I feel like you fall back on like the oldest cliche or at least stereotype that, well, Colorado's a healthy state. That's got to help, right?
Right. I wanted to really include that perspective, right? Don't just focus on one factor, which is the number of beds. The other things are that we have good preventative care. We're ranked high on that, as well as quality of care. All of those are very important when you are looking at the overall health of the state. But Kyle, one of the things that is definitely a work in progress is access to care. Can people afford and do they have coverage to even go to the doctor in the first place?
Yep. All right. Thank you, Anusha Roy.